welcome to MedX 360. I'm Sheri Jamkhou, and joining us now is Dr. Kunal Sharma, who heads Center of Excellence Histopathology for SRL Diagnostics. Hi, Dr. Kunal Sharma. Thank you for being with us today.
Hi, thank you for the introduction, Sheri. The pleasure is all mine.
So tell us, what is oncopathology and what is so critical about it?
So oncopathology is a specialized type of pathology which deals with the diagnosis of cancer. And we also run a variety of tests which help us to better understand what treatment would be effective in which cancer patient.
Definitely. And now when it comes to testing, how has the spectrum of testing for cancer patients changed over the recent years?
So you see, in cancer, the most important thing is a correct diagnosis. A wrong diagnosis would mean wrong treatment, and the implications of that are very severe, not just in terms of costs which are involved, but also the fact that the patient, you might lose the patient. So erstwhile the cancer testing was predominantly based around the fact that we needed to know the diagnosis, that what type of cancer a particular patient is suffering from. But as we have moved over the years, we have now started doing a lot of molecular tests and genetic tests, which also help us to understand what particular mutations exist in which particular patient, and that helps us to better understand what treatment would be effective and what treatment would not be effective. Today, the treatment of cancer is very personalized. Same two cancers in two different people do not behave similarly, because cancer is a biological disease and the biology of those two cancers is different in those two patients. So we need to understand, what forms the molecular basis of cancer in each patient, and that's where our advanced testing is centered around.
Definitely. So what exactly is the role of chemotherapy, radiation therapy, and surgery when it comes to the treatment of cancer?
So you see, cancer could be, local, that is in a particular organ. Cancer could be loco-regional, that is, it could spread to the surrounding lymph nodes, or cancer could be widespread, that is what we call as a metastatic disease. So based on how much is the impact of cancer, there are different modalities of treatment that you can use. Surgery is usually for local cancer, wherein the cancer is just removed with clear margins, whereas radiation aims to treat a loco-regional disease, in which we also give the radiation to the bed of the cancer, and that helps us prevent recurrences, whereas chemotherapy is systemic treatment which aims to target widespread cancer which is spread to different parts of the body.
Right. So with the differences in treatment and the differences in the different cancers, is cancer curable?
Indeed, most of the cancers are curable. We have a variety of cancers. And as the old dictum goes that, whenever a cancer is detected early, whenever a cancer is detected correctly, chances of it being treatable are far more.
Right. So with the changes in treatment over the years, has that made cancer more curable, or is, diagnosing early what has made it more curable?
So it has been a multimodality approach, early diagnosis, good screening tests, and understanding the molecular biology of the disease and development of drugs which can target those molecular mutations. We have moved from, so for a widespread cancer, we used to have chemotherapy earlier, but we have moved into an era where now we are using targeted treatments and immunotherapy, in which we are targeting the molecular mutation in a particular cancer, or we are strengthening the immune system of the person to better fight disease. And thus we are seeing that cancers in which patients would not survive for more than 15, 16 months, today seeing even 5-year cure rates are not, it's not unusual or uncommon.
Right. And as you mentioned, so molecular testing is coming up in a huge way with numerous labs doing such tests. Please share a little bit more information and shed some light on molecular testing.
So, what we have realized about cancer is that cancer is a biological disease, and there are different cancers which harbor different molecular mutations, and many a times those molecular mutations can be targeted through what we now know as targeted treatments. So basically, we have now in diagnosis gone. We call it diagnostics beyond diagnosis. So we don't just tell you what cancer a patient is suffering from, but we also run these array of molecular markers which help us understand how this particular disease is going to be, what would be the prognosis of this patient, and whether there is an actionable mutation. These are mutations which can be targeted through certain targeted therapies. And in these targeted therapies, unlike your chemotherapy, these are very specific to the cancer cell. So they don't affect the normal cells of the body that much. And the side effects are also much lesser.
Right. So with your mention of targeted therapy and immunotherapy, when can we give them to a patient and where are they indicated?
So, we need to test each patient for the underlying molecular mutations which exist. And whenever we see, there are a variety of genetic tests available in the market, which are multi-gene panels. And wherever you see that there is a target which can be treated, or there is an actionable mutation in a particular patient, those are the patients in which targeted treatment is indicated. If there is no actionable mutation, you should not give targeted treatments because they are very expensive and the patient will not benefit that much. In immunotherapy, we do something which is known as a PDL1 testing, which tells us whether immunotherapy would be effective in a particular patient or not. So there are a variety of PDL1 clones, and each clone is indicated in a different setting with different cutoffs. So based on that, we do that PDL1 testing, and then we figure out whether a patient would benefit from immunotherapy or not.
Right. So when mothers save the stem cells and such, is that useful with things like this?
That would probably be useful in terms of understanding the genetic compositions, and it definitely does pave way for a lot of research in the future. But when a particular cancer patient comes with an actionable mutation, there you definitely need to see whether there is a drug available in the market to treat that mutation or not.
Right. So, Doctor, you head Histopathology Center of Excellence in Digital Pathology for the largest chain of path labs in India. Please share a little bit about advancements in digital pathology and how are they impacting overall testing, diagnosis, and cancer-based testing?
So, digital pathology has completely changed the way we see slides these days. Earlier, let's say if there is a patient who has been diagnosed with cancer in Africa, they would need that biopsy to physically travel. And if I need to see that, so they would need the biopsy to physically travel to the location where I am for slides to be remade. And whenever you make a slide, there is an amount of tissue which gets depleted. But with digital pathology, you can place the scanners anywhere, and you can see these high definition images sitting anywhere across the world. And that also gives you a lot of power to objectify, because there are different tools in digital pathology which help you understand parameters like, let's say, depth of invasion, whether perineural invasion is present or not, to count mitosis in a very objective fashion. So it just makes your reporting very, very objective. Plus, it also gives you a lot of artificial intelligence tools that you can use to build algorithms for different systemic cancers, for diagnosing them better. Let's say prostate cancer or breast cancer.
So you mentioned, the buzzword artificial intelligence. Tell us more about the role of AI in pathology, please.
So AI is definitely here to transform a lot in pathology. We are seeing, AI for creation of algorithms in systemic reporting, as I told you, which could be colon cancer or prostate cancer. What it does is that it also, tends to raise red flags in places which could be missed. Let's say there is a pathologist at the fag end of the day, and even in something as simple as a cervical cytology, if you see hundreds of smears throughout the day, your pathologists do tend to get tired, and they might miss out certain areas. But there are different algorithms even in cervical cytology which help you raise red flags in positions which you should not miss out. So a pathologist pays extra attention to those areas, and from there to a lot more advancements in terms of systemic cancers, in terms of understanding Gleason score in case of a prostatic cancer, in terms of understanding even cancer spread, how cancer would spread, and drug development for different types of cancers. So digital pathology and AI are paving a way for a completely different future.
Definitely the way of the future. Now, we read about your partnership with Path Presenter. Please shed some light on that.
So Path Presenter, as you know, is one of the most acclaimed platforms for the use of digital pathology and artificial intelligence tools globally. And myself and Dr. Rajendra Singh, who is the co-founder of Path Presenter. So with Path Presenter, what we are doing is that SRL already has 3 reference laboratories which are digitally empowered. Our laboratory in Mumbai, in Gurgaon, and in Bangalore. And what we are basically doing is that we are integrating these 3 laboratories with the Path Presenter clinical consult platform, which will help us, see cases digitally, and it will integrate the report with our lab information system. So automatically, a good report from our lab information system would be released across our digitally powered laboratories. And also it gives us a lot of AI enabled tools, as I told you, to develop more and more new things and to validate newer protocols in cases of systemic pathology.
That is wonderful. So we have a bright future when it comes to curing cancer, hopefully. Thank you for your time with us, Dr. Kunal Sharma. It's been a pleasure today.
It's definitely been a pleasure here as well. Thank you so much for having me.